Okay, we'll call the meeting of the Community Health Board to order. First, Community Health Board. Yeah. Didn't I say that? Yeah. Oh, yeah. First thing on the agenda is the approval of the agenda. Do I have a motion to approve the agenda?
So moved.
Motion by Commissioner Carlson. Here a second. Well, I'll jump at once.
I'll second.
Second by Commissioner Winger. All in favor of approving the agenda as presented, say aye. Aye. Any opposed? All right. The agenda is approved. Next item on the agenda is the approval of the minutes from our January 21st meeting. And everybody should have had those in their emails. So look for a motion to approve the minutes.
So moved.
Motion by Carlson, the second by Sumner. All in favor of approving the minutes, say aye. Aye. Any opposed? Motion carried 5-0. Community Health Board Program and Services update. Amy, take it away.
Good afternoon, Commissioners and Community Health Board. I am Amy Bowles. I'm your Public Health Director, and today I'm representing you speaking before you as your Community Health Services Administrator. So to kick off our meeting today, I'm going to talk to you about some of not the grants in particular, but the grants that we have that support the work we do as a Community Health Board and through public health. We want to make sure that we're providing program updates to you guys and services that we're providing in the community and in our clinic. So to get us kicked off today, I have Cami Kelm. She is one of the newer members to our team, but not new to Beltrami County. So you may have seen her around. She is a social worker with our department, and this afternoon she's going to speak to you about Beck and Tiny Tots.
Hi, Commissioners. Thank you for allowing me to chat with you a little bit today. Like Amy said, my name is Cami Kelm, and I've been with Beltrami County as a social worker for the last 14 years, and I've worked in the community for like 25. So I've done a lot of collaborating over the course of time. And I joined public health just earlier this year under the public health umbrella. So I am new there, but not new to services and collaborations and things. Beck is Bemidji Early Childhood Collaborative. I don't know if you guys are familiar with it, but I am also a board member on Beck. And so that's the partnership that I wanted to talk with you about today. Having worked with high-risk youth and families for the majority of my career in Beltrami and surrounding areas, I've found that many of my clients have benefited from my relationship with Beck and the services that they provide. And I'm grateful to have the opportunity to work with so many different community agencies and programs and events and that sort of thing through that partnership as well. Beck was established in 2018 out of the Thrive Initiative, and with a mission to promote culturally responsive, healthy development, quality education, superior childcare, and family support for children's ages birth through 5 in the greater Bemidji community. This vitally important work is accomplished through the power of collaboration, community outreach, and advocacy for early childhood mental health and overall well-being. That's the mission statement for Beck, and it encaptures what the purpose of that agency is. Some of the programs include MAP. I don't know if you've heard of Movement and Play, but that is a really, really popular program here in the Bemidji community. It's an opportunity to bring littles to a place to play on Friday mornings. We host it at various locations. Stay Fit Parenting Group, Gather and Grow is support training and networking for local childcare providers. Beck also plans different professional development workshops for early childhood age community, and there's a postpartum depression awareness campaign that is headed up by Beck as well. But what I'm really here to talk with you about today is some of the events, Tiny Tots being one of them. We're just coming off from Tiny Tots and Week of the Young Child, which Tiny Tots is a safe, sober, family-friendly, free event that has grown over the years. We brought it back to the community about 5 years ago, I think. And it's a great way to get health information and early childhood program information to parents. There's lots of fun activities for the kids. It's grown and we've had to increase the capacity for where we've held it, and it's now held at the Sanford Center this year. And we had over 600, well, we had, I think, 658 attendees come through this year, and over 30 vendors and over 30 volunteers also, aside from the vendors. So it's a growing large event that that public health has partnered with BEC to be a part of. Some of the feedback from parents and families that over the years for that Tiny Tots event is that they would love to see more of that kind of thing offered in the community, because it's family friendly and fun, and it's a sober, free activity, that people can do. So it's been a great thing to collaborate and be a part of. Upcoming, and Amy, I don't even think you know about this one yet, but upcoming event that BEC is going to be planning, Nature Neighbors Resource Fair and the Okie Dokie Brothers are going to be in concert down at the waterfront in June. So that's going to be another opportunity for us to collaborate with and work together on. And then, being a part of BEC has allowed me to stay apprised of current community resources, events, and opportunities for the families that I serve. And that's been invaluable for me as a social worker. And the outreach and collaboration that we are able to do through BEC fits really well under the public health umbrella and outreach within the community as well. So thank you for letting me share. Do you guys have any questions at all?
Commissioner Carlson?
Yeah, thank you, Mr. Chair. The Tiny Tots, was that the thing that was just like less than a month ago at Sanford?
Yep, April
I heard that was
5th
really cool.
at Sanford Center.
Yeah, I heard
Yeah.
that was really cool.
Yeah, it was a
Thank
lot
you
of
for
fun.
that. Yeah, thank you.
I had a question of, you said MAP, Move and Play. Where does that event or where do those things happen at?
MAP is, we offer it in segments. The winter MAP session is coming to a close, I think, April 25th, next week. And then there will be a small break until June,
Oh.
where it will move for summer MAP out to the Paul Bunyan School. And so it's outdoors in the summer months, and then BEC coordinates usually with the Boys and Girls Club. We would love to see a partnership on a more permanent basis where we didn't have to move all of the equipment from location to location and store it. So BEC is looking for a more permanent location for that. And that is a program that has become really popular with the families in the community as well, because it's free and safe.
Commissioner Sumner?
Yes, thank you, Cami. I appreciate the presentation. I got a few questions. Can you remind me what BEC stands for?
Bemidji Early Childhood Collaborative.
I couldn't remember what the B was for, if it was Bemidji or Beltrami. So a couple of questions that I have is, so the public health does a partnership with BEC, or you're a member of BEC that?
Well, I got connected with BEC through being a social worker with Beltrami County. And I was part of a community meeting. And through that, with some of the committees that I was on, they had asked me to also join the board.
Hmm.
And so it's a little bit of a dual relationship in some regards,
Okay.
because I'm also on the board, but I think we do a good job of partnering with
Yeah.
BEC for a lot of the things.
Okay,
So,
yeah, that sounds good. So does public health have other childcare collaborations or collaboratives that are taking place in the county, or is it just with BEC, or is there other childcare centers that public health works with, or how does that work? Because, like Commissioner, Carlson said, the Tiny Tots event, was really, I seen it was well attended, through, local, press.
Mhm.
And I think it's great. But one of the concerns that I have, as a commissioner from, the north part of the county is oftentimes folks aren't able to get down to Bemidji, for these types of things. So I'm wondering if there's a possibility to offer some sort of similar activities for folks in Black Duck or Tellier, in that area, try to get them more involved because, as a county, I think, we should be more inclusive and offering the same types of things to everybody. Is that a possibility, or how would something like that work?
Yeah, it's funny you mentioned that because I was talking with, Susan Ninham actually at the
Yeah.
Tiny Tots event. And she is trying to plan or would like to plan something similar in Red Lake.
Okay.
Like a health and wellness expo
Mhm.
for families to come to. And, I don't know where that's at in that planning
Okay.
process, but, Tiny Tots itself came out of Bemidji Early Childhood Collaborative. And then Beck grew those partnerships. So Beltrami County got involved because of outreach, from
Yeah.
Beck. But I would love to see that happen,
Yeah.
in Black Duck and Kellier and Red Lake and all of the communities. So that's
Well,
definitely.
and I think things will happen in due time, it sounds like you guys are doing great work there. I'm also curious to know, how many families do you serve through Beck or public health that relates to, the childcare? Because I think over the, past few years, we've heard and understand that there is a childcare need.
Mhm.
So I'm hopeful that through public health, this is something that we can address or improve.
As far as childcare, Beck does support for childcare providers. So a lot of you may be familiar with the Gather and Grow. Every year there's a big childcare appreciation that happens at the Eagles. Lots of donations are gathered. Beck is a part of that in providing supports to the service providers within, the childcare providers in the way of training and education, and then just monthly meetings for, what's happening and communication and that kind of thing. So that's Beck's role in that. But also just being a point of contact for all things early childhood within the community is kind of the desire of the Beck agency, is being kind of an umbrella organization for a lot of the early childhood age stuff. So yeah, I recognize for sure in my role at Beltrami County, the necessity for additional daycare
Yeah.
to be.
But thank
Available.
you. I don't want to seem like I'm interrogating you or
No,
anything. but
I'm
just curious, So I appreciate the work that you guys are doing. Thank you.
Thank you, Commissioner Sumner. Anybody else? No? All right, thank you.
All right,
Appreciate
thank
it.
you.
What else do we have there, Amy? We got
The next, I would like to introduce you to Alex Munson. He is one of our family health techs, and he is going to speak to you today about the One Fruit, One Vegetable program. I got it right? I called it a fruit again, didn't I?
Yep. Good afternoon, commissioners, and thank you for the opportunity to speak today. Like Amy said, my name is Alex Munson. I'm a family health tech here at Beltrami County Public Health. I'd like to take a few moments to talk about the One Vegetable, One Community program. Amy always gets that one wrong. It's a simple concept. Make gardening accessible to as many in our community as possible, regardless of experience or socioeconomic level. And the best way to do that, we found, is to focus on just one vegetable. But beneath the simplicity of it, it's a strategic approach to community health and engagement. Each year we select a vegetable. This year's corn. Seeds are ordered, and once they arrive, we package and distribute about 3,000 packs of seeds and brochures to our community and surrounding communities. We distribute from a few different sites here in Bemidji, in Black Duck, Kelliher, and Washkish. Folks can then plant their seeds, and then they share their stories, recipes, growing tips, and then inspire a better, resilient, and inclusive food system. The results are likewise simple: more people eating locally grown, healthy food, access to fresh produce, creating more gardeners, which in turn can help to lower food insecurity and increase sustainability. And all of this cultivates community pride, engagement, and collaboration. Here in our community, you can look for the corn brochures with seed starter kits at our local county WIC office and public health, the food shelf, or else the public library, the senior center, or at BICAP. And then there's also a few sites in Black Duck at the Resource Center, the library in Black Duck, Sanford Health in Black Duck, Kelliher City Hall, Kelliher Sanford, the library in Kelliher, and then Westwind and Washkish, and also at Harmony. Forgot about Harmony here. I appreciate your time, and I hope to see you all growing corn this year. If you have any questions.
Questions? Commissioner Carlson?
Thank you, Mr. Chair. So in that program, does that allow for the taking of the rabbits that keep eating all my vegetables? Because that would be another food source, of course.
Exactly, if only.
Just curious.
Alex, I get a question of corns this year, what was last year?
Carrots.
Carrots, okay.
Yep.
I've
This is
always
my
had
first
trouble
year on
growing
it.
carrots. I don't know about the rest of you guys, but I
Yep.
don't know if I plant them too deep or what the issue is, but I struggle with planting carrots in my garden.
From what I've heard, packaging carrot seeds is tedious.
Yeah.
So it was a lot better this year, I guess, with the corn. This is my first year doing this, so
Mhm.
I don't have a whole lot of experience, but it's been pretty great so far.
I would bet that carrot seeds would be a challenge because they're so teeny. You get a gust of wind and like, where'd my seed go?
Yep.
Anybody else have any questions for Alex? Commissioner Winger?
I guess I have one. When does this start? Are you doing it right now?
So we haven't started distributing yet. Just this last Sunday, we had a packaging event. And Tuesday, they did one as well last Tuesday at the Boys and Girls Club. I think the idea is to get these packages out by beginning of May.
Okay, so thank you.
Yeah.
Commissioner
Mr.
Sumner?
Chair.
Yep.
So, distribution is beginning of May, and, is there a cost?
Nope, completely free. And this year we started with $0 in the budget, and all of this was made possible through donations. So that was actually
So
pretty awesome.
who would somebody contact, if they wanted to get in touch with someone or you or?
To get in touch with someone like with the program.
Yeah.
There's a few different like there's a Facebook profile for us, OVOC Beltrami. There's a few different sites. This is one of the brochures that come with the seed packet. We just stapled the packets right on the back. And it's got a few different sites for different questions as far as like questions you can ask as far as planting, which goes over in here. Different links to videos. So like for folks that are in apartment buildings where they might not have as much space, how to use a planter for planting corn, because corn typically needs a lot more room. And for the pollination part, there's videos on hand pollination if you don't have enough space. So if you didn't have enough room to grow 10 ears of corn or 10 stalks of corn, then a way to pollinate your corn without having the space, trying to be as inclusive as possible.
Thank you.
Great. Thanks, Commissioner Sumner. Anybody else? All right,
All
thanks,
right.
Alex.
Thank
Appreciate
you.
it.
I'm glad he knows the name of his program because I can never get that name right and I do not know why. It's not that hard.
Did you add yourself to that program?
No, I did not. So just to make sure we stay on time, this portion ends at about 2:30. So I'm just going to give you a couple more minutes of some updates of other programs that we have going on and the work that we've been doing. So I also would like to update you on the mobile services that we've been providing through our dental services, our diaper bank, our milk bank, and our milk depot and our shoe program. So every quarter, we receive 25,000 diapers. That's 141 bags of diapers ranging from newborns to 5T. In addition, we received 19,200 packages of wipes. Don't ask me how many individual wipes come in there because I didn't do the math. But we take those boxes of diapers and we take the wipes, and I'm not part of that. Actually, Alex and then one of our dietitians, Krista, they go over to the food bank and they sort all of those boxes and they put them into piles for community partners to come and pick them up. So we collaborate with the Northwestern Indian CDC and the Northwest Pregnancy Center and Red Lake Comprehensive Health, WIC, and Home Visiting Program, and then BICAP. And so they email them, say your boxes have been sorted, come pick up your boxes. And then once a month, families can go in and pick up one box of diaper per child who's in diapers and a container of wipes. And so if you can imagine, that serves a huge number of people in our community. So over the last quarter, we've distributed to about 85 families. Just between two of the organizations. We don't request them to track all their data, but one of the organizations had the capacity to, and so they sent me their data. And so between public health and that other organization, we reached 85 families. Another program in which we're doing is the dental clinic, and they're actually here today. And so on average, we see anywhere from 8 to 10 children or individuals per day that they're here. Those monthly visits include a general cleaning. And to date, we have 12 people that have been referred that need an additional cleaning called a restoration, in which the company will come back, the organization will come back and set up a clinic day to do the restoration that's needed for those individuals. And then they also provide referrals for individuals who need more extensive dental care. We also have a partnership with Souls for Souls, where we continue to give out free shoes and socks to individuals who are in need. There's no income requirement for that. And then we have joined a collaborative with MDH and have been meeting with Harvard College. They have a program that works on mobile medical services. And so just looking at making our services more mobile in our community versus making people have to come to our clinic to get those services, just because we know that transportation is such a barrier for our community. Another partnership that we've established is with the Northwestern Juvenile Center and Evergreen Emergency Youth Shelter. For both of those agencies, we are providing a vast array of services, including screening for tuberculosis. And then we are also providing med education for their staff, med review for their med administration programs. And then we're also doing the health assessment for all the youth that are admitted into their facilities. And that assessment is a 3-page assessment where we do some early intervention, and hopefully we also are able to connect them in time with referral sources. So we make recommendations to the employees and their case managers on additional services that they may benefit from. And then one of our newer partnerships is with Stellar Human Services. We're providing quarterly support for their group therapy programs. And so this last month, we did 2 different sessions, 12 participants each, and we provided sexual transmitted disease and infection education. And I can't believe I would ever say this, but there was a lot of laughter. They played STI bingo, and so you had to yell out your STI that you had on your bingo card if you got a bingo. So we got a lot of really good feedback from that, but it was a creative way that our community health nurse, Lisa Bjork, actually provided that education for people. So kudos to her. And then she put together a little prize bags for the bingos that included items that we would want people to have to prevent sexually transmitted diseases. All right. I would be remiss if I didn't bring up a really great success for our WIC program. So while this isn't really a partnership, our WIC program has been identified again for another 5 years as being a breastfeeding friendly workplace. And so I just give our 2 dietitians a lot of credit for the work that they do to ensure that Beltrami County is recognized as being breastfeeding friendly, because that really supports and enhances the wellness of the employees that work for us as a county as a whole. And then they also successfully completed a 1-month survey, getting 85 responses regarding the farmers market program. So I'm not sure if you guys are aware, but every year our participants in the WIC program have the opportunity to get vouchers to go get free produce from the local farmers market on Saturdays just downtown here. And so they really wanted to engage with their clients and say, is this program working for you? Do you like it? Do you utilize it? And how can we do it better? So they created a very simple survey. And so I'm really excited to see how they tally up those results and see if it makes a difference in how they provide that service. Just as a point of reference, that voucher is in addition to the WIC vouchers that they already receive for the local grocery markets. So they get a kind of like an extra bonus in the summertime. And then our farmers market participants also benefit from that because they get reimbursed and for their produce that they sell to the individuals. So that's where I'm going to stop and pause and ask if you have any questions. I have 2 more things to cover under this section.
Any questions for Amy on this part so far? Not seeing anything about just pretty much answered it. They bring the vouchers to, is that a physical paper voucher? Are they denominations on them, or do they only have one? So they have to buy them all from one vendor, or how does that work?
Yep, so they get a physical voucher, a piece of paper, and they can receive it in the mail or appointment, or they can come and pick it up, and then they take it to the farmer's market, and then it has a value on it. And so they can spend that at multiple booths if they want, or they could spend it all at one booth.
So if they spend it at multiple booths, how does the vendor, if they go to the first vendor and they get some onions or something, and then they want to go to a different vendor, if they only have the one piece of paper, how does each of the separate vendors get reimbursed?
That's a great question. I have never seen the voucher. So Alex, have you seen them?
They're actually $5 vouchers.
That's what I was wondering, if they were like that, like we do with Beltrami Electric Night at the fair. We have, denominations, and I actually get more than one piece, so I can go buy stuff at different food vendors. So,
You got my WIC extras here.
all right, perfect. Thank you. Go ahead and continue on.
Well, I'm glad you couldn't stop me on that one. All right, so the next 2 things I want to talk about are our specific grants. So the cannabis grant. We have strategically created a partnership with Basque to enhance the diversion program for the youth in our county. So I'm just going to read to you 2 snippets of what we put in our work plan to describe the work that we're going to do through the cannabis grant funding. So we're working on forming a youth advisory committee that will be created with 11th and 12th grade high school youth from Bemidji High School, Trek North, and Voyagers. These 3 specific schools will have 3 different meetings individually, and they'll be scheduled so they can discuss cannabis and other substance use among their peers. The 4th advisory committee meeting that they'll hold will be all 3 committees joined together, and their hope is to develop a youth perspective on cannabis and other substances to start a prevention campaign for schools and the community. After the campaign is developed, the team, along with the youth advisory members, will schedule meetings with the youth to continue and sustain that work. This project will be implemented by Kim Graham, who is the Basque Executive Director, Cami Kelm, who is our public health social worker, and Brianna Schroeder, who is a Basque Interventions Program Specialist. And then the second grant that I wanted to mention to you guys is the Minnesota Department of Health Infrastructure Grant. We were awarded $348,695 through June of 2027. I'm going to give you a couple 3 paragraphs again from that grant work plan, just to give you an idea of an overview of the work for that grant. So the vision for the project for this grant is to successfully build a partnership that includes representation from the 3 tribal nations surrounding Beltrami County Community Health Board. The project partners are committed to learning more from our community members, including youth, people of color, senior citizens. We desire to understand what people do not know and what they desire to learn about. What is health to them? What makes them feel healthy? What would make the community healthy? And we desire to promote and protect our people and know that we can have a bigger impact and make a sustainable difference through the support of this grant. The Beltrami Community Health Board has strategically worked to develop strong community partnerships over the past year. These partnerships have led to the formation of the Native American Advisory Council. In collaboration with Sanford Health, a robust relationship with Red Lake Tribe, specifically the Comprehensive Health and Indian Healthcare Service Programs. And specifically, we also included Cass Lake IHS and Northwestern Indian Community Development Center, and a vigorous and active partnership with the Beltrami County Public Health Information Officer and Emergency Manager. And lastly, our partnership also includes North Country Community Health Services. We wish to build upon these existing relationships to bridge our service and area gaps with the addition of representation from White Earth. Since the time of the application, we have already added representation from Leech Lake. Any questions?
Any questions on any of that? No? All right, go ahead and keep going.
Keep going? Okay. So the next piece of our agenda is talking about our community health assessment and our community health improvement plan. So in your packet, you should have received a booklet. This has draft across it. It was very intentional not to make it so you can't read it, but to make sure that as you were reading through every page, you know that this is in draft format. So my recommendation to the board is that today we'll go over the booklet kind of high level, looking at each page, just making sure that you didn't have any standout immediate questions. And then I would ask each of you if you would have the opportunity to review the booklet in its entirety and get any suggested changes back to me by May 1st, because the completed booklet is due in September. And between now and September, we only have one other scheduled community health board meeting, and that's in July. So if you could get your specific edits back to me by May 1st, that would give me time to go back to Pinnacle Marketing, make those edits, and if you would wish, I could bring another draft copy back to you before the July meeting at either a special meeting, or we could ask Tom if we could add in a special, like a piece part of the work session for the CHB to talk about the work meeting, or I would collaborate with Ann and ask what her recommendation would be for to go over it again. So I want to start with my recommendation. Any questions or suggestions on how to move forward with the revision of the book?
The board okay with getting getting our comments to her by May 1st, and then bringing it just to a regular work session for us to give our stamp of approval in case there were comments, from one particular commissioner or two commissioners, and we could all review those and approve.
And then I would
Yep.
bring you the final draft for you to vote on or
At the-
give me approval at the CHB meeting in July.
Right, yep.
Okay.
That sounds good, thank you.
Okay. All right, thank you for that head nod of approval. So on the first page, I'm gonna just start off by telling you that one of the recommendations I'm gonna ask for is that we can make this Beltrami County focused. And so just to put our draft together, Pinnacle Marketing used stock photos. I'm going to ask them if we can use pictures from around our community because I want this to speak to the community and represent Beltrami County. Also on the cover page, it says Beltrami County Community Health Needs Assessment. The cover will say Beltrami County Community Health Board Health Assessment and CHIP Community Health Improvement Plan. So we'll figure out how to fit all of that on our cover page because I am planning on putting the Community Health Assessment and the Community Health Improvement Plan, the CHA and the CHIP, into one document as you see before you. Okay, so I will try and watch the clock. So the first page you have is your table of contents. I want to make sure that we give credit and acknowledgement to anyone who has participated in our work group or in the review of this process. I would like to know if you guys would like each of your names listed separately, or Commissioner Gould was our representative on the committee. Because then what I would recommend on page 3 is if we leave Joe Gould, Commissioner Gould, under credits and acknowledgement for sitting on the committee, instead of putting a mission statement and guiding principles, I would ask to put a photo of the 5 community health board members, so you 5 gentlemen, and then a statement from you guys. Okay, so I'm gonna go back to table of contents to bring us back to page 3. So under credits and acknowledgement, I still have some additions to make. HRDC and Paul Bunyan Communications will be added, and other organizations that continue to help review the document. So what I've done is sent the draft out to agencies or community partners that have a active interest, or they are considered kind of those subject matter experts in areas that we're covering in this book to make sure they're adequately represented. So any questions about the table of contents?
Were you asking what our preference was with regard to?
Yes.
You know, Commissioner Gould sits on the committee, certainly fine with him being with the rest of the committee members.
Okay.
I don't know if that the rest of us, I would be fine either way, whatever the rest of the board chooses on having us have any representation on there. I don't certainly need that, but whatever, anybody want to be specifically called out in addition to Commissioner Gould or?
Okay.
No?
And so my recommendation, because this is produced and it's the state requirement of the Community Health Board to produce this and submit it to the state. When I reviewed other counties and what they had done or CHBs, they oftentimes, the CHB had a mission statement. And so what I did is I used our Health and Human Service mission statement and our guiding principles and values and used that as a placeholder. And that's where I was wondering if, where there's a picture of the volunteers, if you guys would like a picture of the 5 community health board members, AKA also the commissioners, and you would like to write a statement to the community in addressing in this booklet.
Anybody have any comments or suggestions on what you'd like to see there? Yeah, I have a face for radio too. So, I'm fine with us just leaving the mission statement and stuff in there, but if you wanted, whatever you would like to do, it's, and Commissioner Gould, however you guys, you know, if you think it should be a certain way, you know, I think we're amenable to doing whatever.
Whatever direction I guide you in.
Sure.
Okay, I'll work on this with Ann and our PIO to make sure that we're sending the right message.
Sounds good.
Okay. Any questions on page 3? That was the only comment I wanted to make myself to ask you guys. Okay, all right. So now we should be on page 4 about Beltrami County and our residents. Any concerns or anything that stands out or questions about this page? I have lots of notes on mine, so I'm not gonna like take up your time saying, I'm gonna make this change on every single page.
I was a
So-
little surprised that, that we don't require any kind of proof of residency, so we potentially could have Canadians or anybody contributing to what we need in our county.
So, that is a great, statement. So when we did do you remember last fall, we did the 10 questions?
Mhm.
That we brought before you to say, this is the survey we want to produce. We did not ask for people's zip code. And that's what, so what I did is I gave all of the information to Pinnacle Marketing, and then they're helping us put this into a cohesive booklet. And so I kind of wondered myself too, if that kind of stands out as would it make sense to the public as why that's in there. So these 3 things are just something they pulled out of that 10 question survey that we did. And it was something that we pointed out that we didn't ask for borders. Like, we didn't say, do you live in Beltrami County? Because we recognize, if you recall from I think it was my October presentation, I mentioned that one of the things that we were creatively doing is recognizing that we're not just the county seat here in Bemidji, but we're the county hub, and we're the hub for our Northwest region. So many people from Clearwater County and Lake of the Woods and Hubbard County and Cass Lake, they come to Beltrami County and they utilize our resources. And it's a good thing, right? Like, they come to and they use our parks and they participate in our community events, and they use the pools, and they come to the restaurants and grocery shopping. And so we thought that it would be strategic of us to not ask for people's zip codes, because we were interviewing people who were currently in Beltrami County. So like, we went to different community events. So the likelihood of us interviewing somebody, from 5 states away or another country was pretty slim, just because of the audience and the venue that we went to.
Okay.
Yeah, but it's a good concern.
Yeah, it just, jumped out at me and
Yes,
potentially causing concern for people that would read it.
right. I have a note on here too.
Okay, thank you.
Are you good if I move to the next page?
Yep.
Okay. So page 5 is our Beltrami County demographics. So this page is just going to give us a broad overview of Beltrami County. On page 5 here, $67,257, the median household income. I had 2 different sources, so I need to go back and check which source is most accurate, because later on in our document, that number is different. So when you're looking through it on your own time. Okay, then the next page is your 10 areas of health. So if you remember from that community health assessment that we did, the community survey, we said, what are the top 10 areas that people identify as health need areas, or areas that we should focus on that we're doing well or could do better? And so these are our top 10 areas, and we're starting intentionally with community connection on page 7, because that's what really brings us all together. And that's what the Community Health Board is all about, right? Is looking at how we can build partnerships and we can connect and we can build relationships. So our very first area that we're focusing on is community connection. So any questions on community connection?
Nope.
Okay. Chemical dependency is page 8. This is a really big topic. We submitted 4 pages of data and information to Pinnacle Marketing, and they did a pretty good job, if I have to brag on the work that they created, being able to put all of that information. And so one of the nice things about working, there's many nice things, but one of the nice things about working with Pinnacle is that they're an outside eye, right? And so they can create something for us that doesn't necessarily like have a public health lens to it. And so I might put something in here that I think is really important, but when you have somebody who doesn't walk public health every day, you get another perspective of saying this would mean something to the community. Any questions on chemical dependency?
No.
Okay, safety and security. We are gonna have some changes to this page. I want to include the results from our survey that focused on what are the top 5 events that you would be most prepared for if there was an emergency, like a fire or a flood. And so I think it's really important because of the collaborative work that Chris and I have been doing and that we do with our Northwest partners and the partnerships that we have in Beltrami County for those who help us support emergency response activities, to include that data, because we also want to include a priority area under safety and security in the CHIP. Any questions? Okay. Page 10, I have no comments on. That's Beltrami County Housing. Any questions from this group?
We're good.
Okay, transportation. So transportation can actually touch almost all of the areas that we've covered. And so as you're reviewing the booklet, you'll notice that many of the areas also talk about transportation. And as you guys know, transportation is a huge issue in our county, especially for people who don't live within the city limits and have access to public transportation. So transportation, you'll see that in our CHIP. Okay. Any questions?
Keep on rolling.
All right, education. So this page was specifically sent to some of our educators in our community, including Dr. Olson. And they thought that the response I got was that it represented education in Beltrami County very well. The only thing that I've been asked to clarify is the extra per pupil spending. So I don't remember the exact dollar amount, but on average in the state of Minnesota, schools will spend about $1,500 per student to ensure that they achieve an average level of achievement during their school time. Beltrami County spends on average $3,364 per student to achieve an average level of understanding and achievement in school time.
Is that the total that they spend per student? Or here it shows extra per pupil
Correct,
spending
extra,
on top of the
above
regular?
and beyond.
Okay.
Mhm. Yep, great question. Okay,
Looks like we're good.
yep.
Oh, Commissioner Carlson?
Sorry, thank you, Mr. Chair. Is it helpful at all? Excuse me, is it helpful at all on the percentages of graduation, attendance to compare that with state averages? Is that of any importance that you know of, or I'm kind of curious of how we rank, how that ranks, so I didn't know if that
Like I
was.
have on the other pages where we have
Right, yeah,
comparison.
exactly, yeah.
I think that's a good call out.
Okay, good question. Next, page 13 is access to healthcare. So I had some conversations with Sanford Health's leadership team. We were invited to listen to their community health needs assessment. They have already published their 3-year document for their plan. And so because we want to continue with our good partnerships, but we also want to let them take lead on the areas in which they're doing and come behind and support them. We are choosing to focus the majority of our access to healthcare on this page on dental. But we wanted to make sure that our community members know where to access Sanford's information. And so at the last revision, I asked Pinnacle to include a little bit of information about Sanford's health community needs assessment and a QR code. So I don't know if the commissioners think that's a good idea, but I thought that that would be a really good thing for our community to have access for if they're wondering why do you not have more information about this? It's because Sanford did a massive survey and put together a very robust document. And so I would like for them to take lead. And then what they did is they reviewed our document to make sure that it coincides with theirs and matches well with the information they're putting out.
I think that's a efficient way to cover it so that they have access to the full document instead of trying to clutter it up too much in here.
Okay.
Everybody else agree with that?
Because
Looks like
that's
we're
their
getting,
number one thing that they're working on. So
is that the one where you had over 700? They had over 700
yes.
survey people and we overshot quite a bit by what the expectation was.
So for us, we were hoping for 200 and we got like 585. And I think they were shooting for close to 1,000 and they got like 800 and something.
Okay.
So yeah, which is way higher than what they had done 3 years ago. So they were also very excited about their increase in numbers.
Great.
Yeah.
Looks good.
Okay. Page 14, economic opportunity. So I did reach out to a few community partners to help provide data for this page. So a lot of this information came from Dave Hengel and from Anthony, I don't recall his last name, but he works with Deed.
Okay.
So I can't answer a whole lot of questions about my knowledge of this topic. It's not my area of expertise, but I do feel that it's really important to have in our book. Any questions?
We
Okay.
Just gonna keep moving along.
Okay, food security. And so as you recall, we created a library, and in our library for public health on our website, we also created a YouTube channel. And so if you scan that that QR code, that will take you to our YouTube channel where you'll find 2 videos, one on food security and one on food stability. We have a total of 6 videos now on that website. And then the 7th video is our last community health board meeting. So Diane will be publishing our community health board meetings on that YouTube channel.
Cool.
So don't make me cry. Just kidding. Okay, any questions on food security?
No.
Okay. All right, medical health. So this one, we also wanted to be careful not to focus too much on medical diagnoses, but more on kind of big bucket categories. Because again, Sanford really has the leading data on medical diagnoses, and we can get that information from Sanford's community health needs assessment. And so we did try and pick out some of the kind of big bucket items that we see in our community, such as our suicide rate, our teen birth, and sexually transmitted diseases. Any questions? Okay, so then are moving into the improvement plan. So we'll have a transition page that talks about the survey that we did, and then the recommendations we made to the board in creating our health priorities. So if you don't have any questions on page 17, I'd like to spend the remainder of our meeting talking about the health priorities if you have any questions on them. What I do want to tell you, and I know it's kind of a distance from there, I had 1 page for each priority and Pinnacle put it into 1 page total. So I have a lot more details in mind, and I'm going to sit down and work with Ann on to make sure that we're articulating them in a way that makes sense to the community. But essentially what we're doing is taking the top 4 health priorities identified from our community survey, which is chemical dependency, housing, safety and security, and transportation. And then we're required to write a goal, write strategies, policy recommendations, set metrics on how we would measure that, and then identify who our partners would be and set on those goals that we're working on. Now, I want to remind you, the Community Health Board is responsible for producing the document. We are not responsible for producing all of the activities, writing the policies, implementing any of the plans. We're a partner in the work that's being done. And so what I tried to do is strategically look at things that organizations that we're already partnered with or that we're building partnerships with. And I said, what are you guys already doing in these areas and how can we come alongside you and support you? And wrote those into our community health improvement plan.
Okay.
And that's my presentation.
Perfect.
Any questions on the last page?
Do you have any last questions for Amy? Doesn't look like it, Amy. I think, I've read through it, but go through and look at sending you some potential changes, and then we'll look at the draft that you send back to us and make a decision later this summer.
Okay, that sounds like a good plan.
Great.
And I even gave you guys enough time for a quick break before your next meeting.
Thank you very much, Amy. Appreciate
Okay.
everything, updating us. So look for, any last minute comments from the board. We should probably mention when the next meeting is July
I lost my cover page, July 15th.
15th.
And Mr. Chair, there's
Yep.
a item on the agenda related to possible future topics. I'm interested in hearing more from Basque.
Are you talking about the work meeting? That there isn't on our.
No, number 6 here on agenda, it
That's
says,
the work meeting, isn't it?
no.
Nope, for
number
my meeting.
6
Where's,
Number 6, commissioners' comments and agenda additions for next meeting.
oh, okay, I missed that part. Sorry, Commissioner Gould. I was looking at the next meeting part.
Well, that's okay because it might be more appropriate for a county board meeting anyway, or a work session, but I know Basque does fall, we do have some parallel or overlap work with Basque with this group,
Mhm.
and they were mentioned earlier. I'm just wondering if we could have someone from there come in and do a update and report on what's going on, perhaps with that youth advisory. There might be an update at our next meeting on that. But I'm really open to any and all, noteworthy items that they've been working on currently. I don't know if we could fit that in with this group.
Be up to the board what our wishes are, and what that really could fit into either the community health board or our regular work session topics. Anybody have any preference as to whether we do that in July or do it at a regular work session between now and July?
Mr. Chair, I like Commissioner Gould's idea. I think maybe it might be better to do it at a work session so that we don't take up valuable time that we usually only have an hour with Amy once a quarter. And I think maybe if, rather than clog that up, I do it at a regular work session. Is that
Others
okay?
feel okay with that?
Commissioner Wigner sits on the board, as do I. How would you like to go about approaching Kim?
As far as the Basque,
Yes.
I think Administrator Barry can
We'll take
probably,
care of that?
yeah,
Okay. I just
line
wanted
it
to
up
make sure it
for-
wasn't a responsibility of mine.
nope, yeah,
Okay,
thank you, Amy.
okay.
And then I did have another question about, I think is one of our committee assignments. I forget who sits on it, but Behavioral Health Community Collaborative. Is that an organization in the area, or is that strictly a division of the county?
I don't sit on that. I actually was asked to be a guest speaker, but would either of you like to speak? Do you know?
Or Commissioner Winger?
Yeah, we're really up against the clock here too, so, yeah. What are you wanting from that, Commissioner Gould?
Just update and report on what's going on with either that organization or that group of folks, either for this meeting or a future work session. I don't care where it gets fit in.
And do you have a suggestion on whether that would be something that would be strictly for this group, or whether that would fall into a regular work session topic?
The Behavioral Health Collaborative would come to a work session.
Okay,
And I can certainly set that up.
great, thank you.
Yeah.
Anything else, Commissioner Gould?
No.
All right, motion to adjourn the Community Health Board. Motion by Carlson, Mayor second.
I'll second.
Second by Commissioner Winger. All in favor of adjourning our Community Health Board for this session? Aye?
Aye.
Aye. We are adjourned.